Hi, everyone. Welcome back to another episode of Collectively CoeXisting, a podcast by Remember the Girls. As part of our Carrier Connections program, we feature a different X-linked condition every month, and in the month of November, we are featuring Hunter syndrome. Carrier Connections is a program that's sponsored by Horizon Therapeutics, Sanofi, and Ultragenyx Pharmaceutical. And today we have with us Cristol, who is the founder and CEO of Angel Aid. She's coming on here to talk about her experience being a carrier of Hunter syndrome. And the two of us have been connected and our organizations have collaborated. And we are so excited to have her on today to tell us a little bit more about her and what drives her passion for advocacy day to day. So Cristol, thank you so much for being here. And I'm going to pass it to you to just give us an introduction, tell us a little bit about yourself, and then we'll dive into some questions.
Fantastic. I can't believe this day has finally come. I'm so excited to be interviewed by you and to join you today. So my name's Cristol Lachlan. I'm the founder and CEO of an organization called Angel Aid Cares. I established that organization in the year 2000 as a way to honor the passing of my brothers. I had three older brothers, David, Jared, and Randy, who passed away from Hunter syndrome in the 1980s. So they were 12, 18, and 19 years old when they passed. And my oldest brother, Richard, who does not have the disease, he and I just felt strongly that we wanted to do the cycle of raising money, sponsoring research, and finding a treatment or cure for Hunter syndrome. And I'm so delighted to say that we've done that sort of full cycle of philanthropy. There's a really amazing set of treatments for Hunter boys these days, and young men that would have passed away in their teens are going off, to college now. And it's just been our great honor to witness that. So yeah, so that's me.
That's so amazing. So you mentioned that you had three brothers that had Hunter syndrome who all unfortunately passed. When did you first learn that you were a carrier of Hunter syndrome?
Yeah, that's a question. The absence of information is reality, I guess. And I grew up thinking that I was not a carrier. In fact, my mother and my father met in the 1960s, and they got married in 63. And they were 8 months pregnant with their fourth son when they realized that their second and third son, David and Jared, were not developing the same way as their oldest son. And so it was a bit of a shock to find out that three of the four boys had Hunter syndrome. What was even more of a shock was they got pregnant again with me. And so I was one of the first amniocentesis babies, and they actually told my parents, she's a girl, she's a carrier, and she is not a carrier, and she does not have the disease. So you're safe to have her. And I kind of grew up my whole life thinking that I wasn't a carrier of Hunter. And then when I came into my 20s, started getting kind of serious in relationship and having conversations about maybe starting a family with someone. And he was asking a lot of questions about my carrier status. And so I went back and was retested. And it was then that they discovered that actually, yes, in fact, I am a carrier, that those tests back in the 1970s were only 50-50 accurate, and your chances of being a carrier are 50-50. So I was on the other side of the 50%. So yeah, it was later in life.
So what was that moment like for you? I can't imagine, going through your young adult years thinking that you weren't a carrier and maybe envisioning what the future looked like, and then suddenly finding out that test was inaccurate. What was that like?
Yeah, it was a life-altering moment. It was like a switch gets thrown, and you're just everything you thought reality was, and your future illusions, of what you think the future will be like, really shifted. And I'm a very analytical person, so immediately wanted more information. And I remember calling up my father and saying, there's a conference happening in Minnesota, the National MPS Society was hosting a family conference, and I said, I think we should go. I just found out that I'm a carrier, and so, will you go with me? And he said that he would. And so we got on a plane and we flew out to Minnesota. And I remember walking into the hotel, and, bear in mind that my brothers passed away in the 80s. I was the youngest. So my memories of my brothers are very, very positive, happy memories. When you're a child, you're, often insulated from the realities of what's going on health wise. Kids just relate to the heart connections and the vibe and all of those things. And so even though my brothers were very sick and they had lost their ability to walk and to talk, we still connected, through kind of grunts and pushes and pulls and hair pulling. And I could tell when they were happy or sad or frustrated or those sorts of things. So my memories were very positive, but I was very, very young. And as they were passing, and walking into, fast forward 20 years later, walking into this hotel lobby and seeing all these boys that look like my brothers. Hunter boys have a very specific coarse facial features, and they just have a very similar look. And I just, gosh, I'm going to cry about it now. I mean, I just remember looking around and feeling like, what? These are my people. This is really like a homecoming. And then I looked over at my father, and he had gone completely white, like ashen white, looked like he was going to pass out, and just had this really distressed look on his face. And I was like, Dad, you need to go get a beer? And he was like, yeah, I need a beer. And I was like, okay. Like, we went straight to the bar, which I don't know if I should be telling that part of the story, but that is the reality of it. It was a huge shock to him to be pulled into this environment, and I'm sure like flooded with all these memories and things like that. So my first reaction was shock. Second reaction was, I got to get more information about this. And then certainly my third reaction, because that was the year that we started Angel Aid, was what can we do to improve the condition, for this community.
That's such an amazing story. And I can imagine that just being a flood of so many emotions, because especially, now you can just go on Facebook and you can connect with people instantly from your disease group. But then, and it was the same when my dad was diagnosed in 2001, like there was no way to go. There was no way to go on the internet and connect with people. Like, I know that my mom, sometimes, I think this was also back when HIPAA was different, but they could connect patients more directly, like over the phone. Yes. So that's what it was. And, I can imagine too, not having seen any other boys and teenagers with this condition other than your brothers. Like I can't imagine the flood of emotions, both that you and your father experienced in that moment.
It's true. It's true. And it was an interesting, you come back into your home life. So we flew back from Minnesota. I had met all the doctors, the Chester Whitley, Joseph Munzer, Elizabeth Neufeld, all of these lifelong invested researchers in MPS. And then you fly back to California, and you're back in your home life and your home environment, and I just kept waking up every day, and I was like, we've got to do something. And maybe that's the power of I went to UCLA. I was a Pi Beta Phi sorority girl, and we were always giving back and doing volunteer efforts. And we were post graduation, but we were still getting together on Monday nights to watch Ally McBeal and 90210. So now I'm dating myself, but we got together one Monday night pretty recently after Minnesota, and I said, there's a whole part of my history that I haven't shared with you gals. Like, you're my best friends, but we didn't really talk about it after David, Jared, and Randy passed away. I was 10 when Randy passed. and 13 when David passed, and 15 when Jared passed. And literally like the whole rest of the family, both my parents, my brother and I, we just kind of went into lockdown emotionally for the next 10, 20 years. We didn't really talk very much about that part of our life. And so I went through all of high school and college without really talking about my brothers that had passed away. And so I had to kind of do a big reveal, because now my identity had shifted. Now I was identifying as a carrier, and I was like, wait, I'm going to have to grapple with these new realities. And I didn't even know what the realities were going to be at the time, but I just knew that there was a fundamental shift. And so I felt the need to talk to, my trusted friends and explain, and then also, mention that that I would like to give back and I would like to do something. And all of them, it's also going to make me cry. They were all like, start a foundation, let's do a fundraiser, let's just do this. And so immediately these women, and bear in mind, we're all in our 20s.
Yeah, you're so young.
Right?
Yeah.
We're so young. We don't even know what we're talking about. So we decided that we would not start a 501c3. We decided that we would be a fundraising arm of the National MPS Society. So they would do all the governance, they would, process all the checks, they would eventually, if we were successful in raising money, they would actually offer the research grants and do the scientific evaluations and all the governance around, the administration and measurement of the grant parameters. And we would just throw parties and raise money, right? And so Angel Aid became the partner of the year for like the next 3 years running for the MPS Society. The MPS Society was started by a group of parents. And at that time, when we called them up on the phone, because it was not like email outreach or anything, we just called them up on the phone. I remember the treasurer answering Steve, and he says, wait, who are you and what do you want to do? And I'm like, oh, we're a group. We call ourselves Angel Aid, and we want to raise money for the MPS Society, and we're just going to start sending checks. Where do we send them? And he was just like, what sort of odd miracle is this? And that first year we raised about almost $17,000. And then the next year, 2-3 years after that, we raised close to $100,000. And we were able to co-sponsor our very first research grant with the National MPS Society, which went to one of the fathers of research in MPS, Dr. Emil Kaukas. So he was the recipient of Angel Aid MPS Society co-sponsored grant. So yeah, so I got the bug like really early on, like, advocacy, philanthropy, fundraising, and it's set the stage for the whole, literally like rest of my life to this day.
Yeah, I'm excited for you to share more later about, how Angel Aid has developed over the last 20 years.
Yeah, 23
years.
Yeah.
First I want to talk about, you were doing this in your 20s while you were, having just learned that you are in fact a carrier, and you also mentioned starting to, think about having a family. So how did Hunter syndrome impact your family planning journey, if at all?
It did. Well, the boyfriend that sponsored the, not sponsored, but encouraged the conversations to get a little deeper, we broke up. And I don't actually have like a specific conversation where he said the words, I don't want to go down this path with you, meaning down a path of knowledge that you are a carrier of this fatal genetic disease. And, I don't know that it's my future choice to start a family under those circumstances. We never had that conversation. But I've always wondered, did that weigh into it? It was a stressful time. And what got, I think, more complicated going forward was, when do you talk about that in a dating environment, right? So knowledge, now you have this knowledge that you're a carrier. And, even though we were doing the fundraising and we were we were seeing a lot of progress from a scientific standpoint. It still was not an FDA approved treatment at the time. And certainly there were no cures for Hunter. And so it becomes this kind of emotional and psychological burden for when in the dating process do you reveal this? Is it like date one? So, if someone can't handle it, they just like move on. But you don't really want to lead your identity necessarily. Like, that's not the holistic representation of who I am,
Or, that person might be like, oh, so you think that we could possibly it's together.
How presumptive of you, like, I just want to go have a beer. Like, we don't have to get married, that's it. Yes, exactly. So that became interesting of when to share that. What I did find is that the fundraising was a really great icebreaker for those kinds of conversations, because it was a big part of my life. It's what I do. This is a part of my identity and who I am. And so as people would get to know me, that I was dating and in every other circumstance, by then I was working for IBM, and I was working in media and entertainment, digitizing cinematic archives for the Walt Disney Company, and helping create digital libraries for Sony and for MTV, and launching like the PGA.com and MLB.com and all NFL.com, like all the big .com boom was going on. And so it's getting all these mad digital and technical skills, and pulling those networks into our world when we would host our Angel Aid events, right? So and I remember also too, like really challenging the National NPS Society to do things technically that they'd never done before. They'd never, received online donations. We were like, we have to receive online donations. We have this like very progressive Los Angeles and New York based community that wants to donate. You got to find a way for them to donate online, and online was still pretty new then. And so I think it was a nice way from a dating standpoint for people that were dating me to see that, okay, this is a tragic story of loss. And it's also a harsh reality for Cristol and in her future, but there's such a positivity about how it's being handled. And there's such hope in, in kind of the future state. And so I felt like from a dating standpoint, that was a really positive way. And, it doesn't have to be your foundation. You don't have, it's just sort of, when you step into service to a community, people tend to step into service with you, including the people you're dating. So
I relate to that so much. Like just it being a lot, I guess, simpler to bring up the carrier status, just because it's interlocked with so much of what you do in your day-to-day life in terms of advocacy, in terms of fundraising. Like, it would be hard, to have a conversation without it naturally coming up, I guess. And I do think that makes it easier. So yeah, I would love to hear, with having a family specifically.
I'll jump in on one thing I have to before we move on to a different subject. My husband, however, would say, wait a second, you made me fall in love with you before you revealed any of this. This is what he would say. So we joke about it all the time. So we're going to be celebrating our 20-year anniversary next year. And I never used to believe this happened, but it happened for us. The day we met, we fell in love and we knew we were going to be together forever. Now, we were in our 30s, so we had both dated a ton and honestly had just like gotten really comfortable being alone. We weren't really looking. And then we met, and then, literally like hiked and went to dinner, and it was like a date that never ended sort of thing. And in that date, because I felt so strongly about how I felt about him, he asked, well, do you think you might want to have children someday? And I said, oh, I definitely want to have children. I think I'd like to have 5. And he's like, 5? I go, yeah, I'm the youngest of 5. I'd love to have a lot of kids. And I go, how many do you want? And he goes, 2. And I said, oh, okay, well, listen, I just need to let you know that I have this genetic condition, and it means that when we go to have our kids, ha ha ha, we're like 24 hours new in this relationship. But I'm sure because this is how I do everything, I'm sure I presented it with a huge smile. I'm sure I was like very, positive, and maybe the weight of it didn't hit his heart, but I was like, when we go to have a family, we're going to need to do some extra genetic testing, and we're going to have some choices to make, and he says he doesn't remember that conversation at all. He's like, 9 months later, we got engaged. 9 months after that, we got married, and he was like, it was well into our engagement when we started talking about where we were going to live, and, what kind of environment we wanted to raise kids in, that it kind of really hit his consciousness. So I just have to represent Jim in this story, because he has a little bit different take on it.
Right. And yeah, Jim spoke on one of our events in 2021 on our Father's Day special, talking about what it's like, being the husband of a carrier of you. And yeah, he did such a great job, representing also the male perspective, of being in a family with an X-linked disease, but sort of on the other side of it, not the one that's coming from this X-linked disease lineage, but being sort of on the other side of it. So he did such a great job talking about that perspective.
Yeah. I mean, he is an amazing man. I am very, very fortunate to have a partner in this journey, because we have a daughter who's a carrier, right? And when we started, we were in our 30s when we met, so we wanted to start right away. And there are so many choices available now, right? There's prenatal testing, which thankfully is still available in our country. At the time that we were pregnant, we opted to do prenatal testing, and we actually had to go outside the country because those labs, because of the politics at the time and the legislation at the time, those labs were not able to process our genetic testing. So we had to go to Australia and do our genetic testing, our prenatal testing overseas. And that was kind of a shock as well. You think like, well, we have the capability, shouldn't we be able to do the testing we want? But the politics can weigh into that. So we were fortunate that we had the means to pay out of pocket and go overseas and get the testing results. And we did know in advance when we had Chloe that she was a girl and that she had tested positive to be a carrier. And, that brings up a whole set of other emotions, because of course you want your child to have an opportunity to be born into the best health conditions that they can going forward. That being said, I'm a carrier, I turned out okay, right? And so we decided that we would have Chloe, and thank goodness, because she's just, she's 16, she's just a powerhouse, beautiful heart, and intelligent, and our number one volunteer at Angel Age. She has a job as a hostess at the Montage Hotel, which is where I'm broadcasting from here in Laguna Beach. She's captain of a cheerleading team at Laguna Beach High School. She's just, really beloved by her friends. And I made a decision to be very open with her. Jim and I decided to be very open with her about her carrier status. And part of the reason why I now do this work full time is because I want her to see how you can take difficult circumstances and flip them into a real positive force in the world. And so, Chloe has grown up in the community. She's grown up going to national MPS run walks and, running the art table, working with hunter boys, because when she goes to make her family planning choices in the future, I want her to have informed decisions. These are heart-led, informed decisions. Her choices may be really different than ours were, 16 years ago. And already we're seeing so many amazing advances in the science and the technology. So we'll just have to see what she decides. We honor whatever choices she makes, hunter boys or angels on earth. So she may make different choices than we made. So
Yeah.
yeah.
She sounds like such an amazing girl, and she's so lucky to have you and Jim as parents. And I think that's such a great message, to know that she knows that there are options available, even if, she doesn't need to make any decisions now. Obviously, she has a long time, but I think that's something that gave me reassurance as a teenager, knowing that I had options, and that if I wanted to have a child who didn't have ALD, that is something that was available to me. And I think that gave me a lot of assurance that, my future wouldn't be so scary and terrible, but that I would be able to, have a family, if that's what I chose to do. So I think that knowledge in the teenage years is so valuable, because it helps you really adjust psychologically, to what the future will hold. And that's why I can't imagine for you, finding out what seems so suddenly in your 20s, like thinking of myself now at 25, I can't imagine, like, if I had not known and just found out now, like, it's impossible for me to even think how differently my life would be and what that would look like. So, and I think it's great that she has you. And of course, I'm sure she has met so many other MPS carriers as well. And to see that, that you can have an amazing, fulfilled, beautiful life, regardless, or being a carrier, that it's not something that needs to ruin your life, or it's not something that, needs to define you. But I would love to hear more. You mentioned that she volunteers as one of the top volunteers for Angel Aid today. So before we jump into our last couple of questions, I would love to hear more about how Angel Aid has grown over the years and what the organization looks like today.
Sure, absolutely. So, you talk about it doesn't have to define you, or it can, right? And I think that's what has changed so much in my life since the knowledge hit my heart. And knowledge is power. My mother didn't have that privilege. She didn't know that she was a carrier. She and my father had no idea, and had 5 children, and lost 3 of them to this disease. So I've always felt very grateful for the knowledge that I have as a carrier, and have tried to really impart that to Chloe. And Phyllis, my mother, and myself and Chloe, we have this series of photos. The 3 of us put our heads together, and we just take them as she's developed, through the years. And I'm always submitting these to the L'Oreal Women of Worth campaign. I'm like, you've got 3 generations, of L'Oreal users here, and also 3 generations of carriers.
Oh, they need to pick that up.
Right?
They really do.
I know. Okay, well, we can't lobby for it. It's an independent review, but we'll just keep applying. And I think, one of these days it will come to fruition. But in the first 17 years of Angel Aid's existence, we really focused on this reality needs to shift. And the way to shift the reality in my mind at that time was to raise money for research and science. Let's fund a cure to MPS disease, especially MPS 2, so that no other family ever has to go through this again. So we are so fortunate, because those research grants, the early grant that went to Dr. Emil Kakas, he had a very elegant solution. If the boys are missing the enzyme they need to break down certain types of glucose in their bodies, then let's create a synthetic version of that enzyme and flush it through their body like a dialysis kind of. So he is the father of enzyme replacement therapy, right? And fortunately, that for type 2 and type 1 and a few others has gone through the FDA approval process. And it has not been an easy journey. It's been and I'm oversimplifying it, okay? But we've participated and we've witnessed the full cycle of money being raised, research grant being awarded, FDA clinical trial, and then FDA approved treatment. And now, going to Washington, D.C. and advocating for newborn screening, because we have an FDA approved treatment. Let's make sure that we're capturing, these hunter boys in families that don't know that they're carriers, just like my family, right? So we feel very strongly there. Okay, so what has shifted in the last 23 years is that it used to be you had each disease community doing this process, right? And over the last 10, 15 years, it's become clear how strong we are when we work together as the rare disease community. So umbrella organizations like Global Genes, NORD has been around for 40 years, right? And they've been supporting each disease community consistently. But the idea that we're really strong together, lobbying together, has been proven again and again, really over the last like 20, 15, 10 years. So what I started seeing were these messages. Okay, we're a community not of 3,000 MPS families. We're a community of 350 million rare disease families, right? And we're a community of, not just one disease called MPS disease. We're a community of over 7,000 diseases. And now they say over 10,000 diseases, because RareX is identifying, with in partnership these ultra rare diseases, right? So now you've got, wait a second, this is, again, knowledge is power, right? It's like a mind-blowing shift in, we did this really great philanthropic work over here in MPS, but what about this broader disease community? And here's the number that hit my heart. If you've got 350 million families times 0 cures, you have a global mental health crisis on your hands. Everybody in the system, and I mean not just the patient, but the caregivers. On average, Angel Aid's identified 2 to 3 caregivers per family. And then the other concentric circles of support, again, up to 5 or more doctors, nurses, genetic counselors, patient advocates, that are supporting those families, right? You've got this massive community of people that are living, they're fueled on hope, but we're not necessarily acknowledging all of the grief and the despair. And that is what really hit my heart back in 2018, and actually it hit my heart in 2016. And I remember it just like talking about it, praying on it, waking up in the morning. And I'm just like, we have to do something. We've got to do something to acknowledge the emotional journeys that are happening with these families. And so that was the big shift. And we actually incorporated Angel Aid as a 501c3 in the year 2018. And we changed our mission to focus on the whole rare disease community, specifically on creating tools and awareness around the emotional needs, the emotional support systems that we can put in place for rare, chronic, and complex disease families. So that's our new focus for Angel Aid, is mental health support services.
Amazing. I think, this idea of having these more umbrella organizations like Angel Aid, like Remember the Girls, that can create these resources that specific disease communities are able to utilize, is so important. We know that, like you said, over 10,000 different rare diseases, like each patient foundation doesn't need to recreate the wheel and have, their own mental health services program, when people from that community can just, go to Angel Aid for those services. So I think that, it's so incredible, how much mental health in the rare disease community has grown since then. And I believe that Angel Aid was definitely a big part of bringing that to the forefront of the conversation. So thanks so much for letting us know what Angel Aid does today. And of course, in the episode description, I will also link to the Angel Aid website. But I wanted to just ask 2 more questions. The first, why did you join Remember the Girls?
Yeah, well, you and I met through the Global Genes conference, and I was just, you're a powerhouse, Taylor. You are, as an individual, with your lived experience, you're a voice for carriers. And when we, had the opportunity to work on the voice of the carrier program and actually, work together to bring in carriers into our hosted 6-week conversation. And then we created all these infographics, to represent those voices. So that's available on the Angel Aid website. And it inspired me personally to want to be part of Remember the Girls. And also, realizing that none of us can do this in a vacuum. When you're dealing with problems of this magnitude, we have to work together. And so Angel Aid formed the Raregivers Coalition. And the coalition is all the stakeholders in mental health and wellness services, from pharma industry partners to our patient advocacy organizations to partnerships like Remember the Girls. If we work together, we can bring relief. So our goal is to bring emotional support services to 3.5 million caregivers being patients, their caregivers, and the professionals that are supporting them. 3.5 million by 2026. So it's a huge number, but it's only 1% of the need, right? So it's not actually a big enough number, right? We all have to be working in concert. So most of the efforts that we have now are leading this coalition. We've got 140 individual members. We've got about 60 corporate partners and patient advocacy foundation partners that are moving this forward. So it's like a movement where we're doing this together, and that's what we hoped to accomplish through our partnership with Remember the Girls, is amplify the voice of the carrier, but amplify also the need for just ubiquitous mental health and well-being support services for all rare, chronic, and complex disease families. So if you go to raregivers.global, you can download the Raregivers emotional journey map and the discussion guide, and you can also access our weekly live support services and our wellness retreats that we offer quarterly. So both of those, we'll continue to partner heart to heart, like you and I do organizationally, and then also as a community. I know that we can bring a lot of relief together.
Definitely. I'm so looking forward to just what we can continue to accomplish together. And I will link to everything Raregivers as well to make sure that our community knows where they can access those resources. But yeah, Angel Aid's resonate. Angel Aid's mission has always resonated with me and others in the Remember the Girls community, especially, with the attention to caregivers specifically, because so many women in our community are caregivers of a child or even a husband with a rare X-linked disease. So, on top of being a carrier and the either physical and emotional impacts of that, they're also a caregiver. So really balancing, these two massive things that, and, you can't look at them separately. When you are a carrier and a caregiver, you have to consider those two identities together because, there are, like they overlap, they intersect, they affect one another. If you say, for example, are having, say, for the women in X-linked disease communities who have physical symptoms, that could, make you feel like you have limitations to being a caregiver, which could cause you to feel guilt or feel like that you are not doing enough for your child, or, you can't separate them. So I think that there's so much more that we can do here and do together. And I'm really excited for that future. So the last question, and this is something that we ask all of the carriers that we bring on to interview and share their stories, is just, what is one word that comes to mind when you think of Remember the Girls?
I spent a lot of time thinking about this. Fierce. That is the word. Yeah, the word is fierce. I think when you know that you carry something in your future that may cause difficulty, that it changes your heart. It changes how you relate to the world. It can create a lot of confusion and anger and denial. And I would just encourage anyone listening to take that confusion, anger, denial, talk to someone about it, arm yourself with information, and move into acceptance. Because what you are now is a warrior. You are different in a really beautiful way. You're moving through the planet in an enlightened way that that others without that information may not have. So fierce.
I love that. That's amazing word and an amazing message, and such a great way to end this incredible interview. Thank you so much, Crystal. I'm so excited to share this with both the Remember the Girls and the Angel Aid communities. And I want to thank you so much again for your partnership and for your time today.
Thank you, Taylor.